My name is Kimgetich Franklin. I'm glad to invite you back to Kenya Pharma Mentor, where today we are going to look at the introduction and classifications of the antimicrobials that we have. Now, may you watch this video until the end so that you may know the classifications that exist. Already you know about the antimicrobials and antibiotics, but today we are just going to do a brief review before you further classify and understand the drugs, before understanding their mechanisms and their contraindications, their dose. So you have first to know about the classifications, because knowing the classifications make it easy and simpler for you to know the rest of the elements and factors which are considered in the drug. So may you feel welcome and watch this video until the end. Focusing on these antimicrobials, and we know that the broad classifications of the antimicrobials include the major 6 parts, which is the antibiotics, antiviral, antifungals, antiparasitics, antiprotozoals, and antihelmintics. So this is just for a start, and we are going to focus so much on the classification as well as to make simple for you and everyone to understand about the pharmacology. Now, from these classifications, we are able to understand and know about the drug before we get to know about the mechanism of action, dose, and thereafter we are going to see the side effects. Now, by introduction, antibiotics are the chemical produced by microorganisms that kills or inhibits the growth of other microorganisms, while antimicrobials is a general term which refers to those agents that kills or inhibits the growth of microorganisms in general. So in short, we can say that antimicrobials are the chemicals produced by microorganisms to kill or inhibit the growth of other microorganisms. So that's the basic. While the antimicrobials kills or inhibit the growth of microorganisms, and these are chemicals. Now, the antibiotics only target the bacteria, but antimicrobials, as introduced, is a broad term, which antimicrobials constitute of the antibiotics. So it's like this is the major classification, and the antibiotics is part of the classification. So the antimicrobials take us against the bacteria, fungi, viruses, and microbial agents. Mainly, antibiotics are natural compounds, while antimicrobials are synthesized from the laboratory. Now, it's important for each and everyone to know the drug by name, because once you know the drug, it will be simpler to understand the mechanism of action and subsequently about the dose. Now, classification is done in 2 major forms, but there are other forms of classifications. The major forms of classifications include according to the mode of action and according to the basis of mechanism of action. Now, we can consider about classifications according to the spectrum and classifications according to the route of administration. But today we shall focus on the major 2. That is according to the mode of action and mechanism of action. Now, on the mode of action, it can be classified into the bacteriostatic, which inhibits the growth of microorganisms, while the bactericidal kills the microorganism. Now, examples of bacteriostatic include tetracycline, erythromycin, chloramphenicol, and lincomycin. While the bactericidal are these that kills the microorganisms, which includes the cephalosporins, penicillin, erythromycin, aminoglycosides, and chlorotrimazole. Now, the major classifications according to the mechanism of action includes the cell wall synthesis inhibitors, which is further classified into penicillin, cephalosporin, bacitracin, and vancomycin. Now, we need to know that penicillin and cephalosporin are other subdivisions, and we are going to focus so much about their classification so as to understand about them. And number 2, we have the cell wall, cell membrane inhibitors, which include the polymyxins. And number 3, we have the protein synthesis inhibitors, which includes the chloramphenicol, macrolides, clindamycin, tetracyclines, and aminoglycosides. Now, remember, protein synthesis can be further classified into those which inhibit the 30S subunit, and there is that which inhibits 50 subunit. Now, in the nucleic acid synthesis, we have the quinolones and rifampin. And we have the folic acid synthesis inhibitors, which is the sulfonamides and the trimoprime. Now, we can begin from the cell wall inhibitors, and these cell wall inhibitors can be classified into 2. That is the beta-lactam antibiotics and other antibiotics. Other antibiotics are just inclusive of phosphomycin, vancomycin, daptoxin, and pacitrazine. So in the other side, we have the beta-lactam antibiotics. These beta-lactam antibiotics includes the penicillin, cephalosporins, carbapenems, and monobactams, as we've seen. Examples of penicillin, as we all know, includes this list. Well, the cephalosporins are divided into the five generations, but for now, we are going to see on the 4 generations that exist here. And these 4 generations are further having the examples, and we need to know about these examples. So by these flowcharts and by understanding this classification, it makes it simpler to understand the mechanism of action and to understand the process at which each drug function, the disease it inhibits, and the rest of the factors. But it's important here to consider about the beta-lactam inhibitors. Beta-lactam inhibitors include the clofenic acid, sulfactam, and tazobactam. Now we have the classifications of these beta-lactam antibiotics with us. Now we need to know that beta-lactams refers to those drugs which contain the beta-lactam ring, which is referred to as here. And this beta-lactam ring is form part of the structure of these beta-lactam antibiotics. So this is the drawing, and it explains. So up to this point, we can further classify now to penicillins. Now, penicillin, as said, could be classified according to the source as natural, semi-synthetic, and these natural are only 2, penicillin G and penicillin V. Semi-synthetic includes the oxacillin, cloxacillin, decoxyline, methicillin, nafcillin, ampicillin, amoxicillin, carbapenicillin, and piperacillin. Now, that is according to the source. According to the root, we have the oral and the parental. So the oral include the ampicillin, amoxicillin, penicillin V, oxacillin, cloxacillin, and decoxyline. Parental include penicillin G, methicillin, nafcillin, and carbapenicillin, piperacillin, and decoxyline. So those are according to the root. According to the spectrum, we have 3 classifications here: narrow spectrum, broad spectrum, and extended spectrum, which at times it can be, it can have an intermediate spectrum, which is the intermediate spectrum composing of penicillin G and penicillin V. So in the narrow spectrum, we see these drugs which they are very sensitive. They have a very high, they have a very low dose, but you have a very strong effect. So this narrow spectrum include the methicillin, oxacillin, nafcillin, and decoxycyllin. So in the intermediate, we have the penicillin G, V, as I've said, and the extended spectrum includes the carbapenicillin, decoxycyllin, piperacillin, and mesocillin. So resistance, according to classifications of penicillin, according to the resistivity, we have the beta-lactamase resistance and non-resistance to beta-lactamase. So which are resistant to beta-lactamase includes the methicillin, nafcillin, oxacillin, cloxacillin, decoxycyllin. Those penicillins which are non-resistant to beta-lactamase includes penicillin G, penicillin V, ampicillin, amoxicillin, carbapenicillin. Those which are resistant to acid, it is classified into 2: acid stable and acid unstable. So at times it can be called acid labile and acid, and those which are non-acid labile. So penicillin V, ampicillin, amoxicillin, oxacillin, cloxacillin, and decoxycyllin are the acid stable types of penicillins. The acid unstable includes the penicillin G, methicillin, nafcillin, and carbapenicillin, piperacillin, and decoxyllin. So note these are the examples, which includes the penicillin-resistant penicillins, which are the carbapenems, which are very broad spectrum, monobactams, which is sensitive against the gram-negative. Extended spectrum of penicillin actually is composed by a penicillin in combination with a beta-lactamase inhibitor. And on the extended spectrum, we say that examples of this extended spectrum includes the aminopenicillins, which is a combination of aminoglycosides plus the aminopenicillins, which is like ampicillin in combination with amoxicillin. Carboxypenicillins is in combination of carbonicillin and carbonicillin in dial sodium. Uridopenicillin is a combination of piperacillin, methicillin, and acetylcysteine. Now, these drugs have greater activity than penicillin G against the gram-negative because they are enhanced and are able to penetrate the gram-negative outer membrane. So, like penicillin G, they are inactivated by beta-lactamases. So, it is working, the extended spectrum works more better than the gram than the penicillin G against the gram negative, but also they are not that much stronger again to resist the digestion by the beta lactamase. So yeah, its work is a little bit higher than the penicillin G, so it is in the middle. Now, semi-synthetic penicillins includes the penicillinase resistance, which is the penicillin, clocaccillin, and ticoxacillin. Now, in the extended spectrum, we have the aminopenicillins, carboxypenicillins, and uridopenicillin, as we have seen. And the beta-lactamase inhibitors includes the clavulanic acid, sulfactam, and tazobactams. So these are examples of semi-synthetic penicillins. We go to the second category, which is the cephalosporins. Cephalosporins are bactericidal beta-lactam antibiotics derived from fungal acromium. They disrupt the peptidoglycan formation in the cell wall. So that's their function, and they have no activity against the LEM. That is, they don't inhibit, or they don't possess any capacity of killing or inhibiting or killing the Listeria atypicals and Enterococci. So in this cephalosporin, it is classified into 5 generations, which includes the first, second, and the third, fourth, and fifth. So examples of first generations include cefaltrocil, cefalexin, cefazolin, cefazodone. In second generation, we have cefazoclone, cefarosine, ceftatone, cefaprocil, cefamine. In the third generation, ceftinir, ceftriaxone, cefadizine, ceftadizidine. In fourth generation, we have the cefepime, cefquinone, ceftobiprone, ceftarolin, ceftasolone. So in general, we say that first generation are predominantly active against gram-positive, with succeeding generations progressively more active against gram-negative. So from first generation is more active against the gram-positive, while the fifth generation is more active against the gram-negative. So it is vice versa. While you are moving from first to fifth, you are increasing the gram-negative. While you are moving from the fifth to the first, you are increasing activity towards the gram-positive bacteria. So adverse effects of these cephalosporins include the nausea, diarrhea, rash, pains, inflammations, and injections. But today I was just focusing on the classification. So cephalosporin, as I said, in the first generation, we have this is how we are trying to master and to know on this classification. So on the other hand, cephalosporin will not act against the 4-LEM, which is the Listeria atypical, MRSA, and Enterococci, which on the other side, we say now, it acts or these cephalosporins could be classified into these mnemonics, which are listed here, and these mnemonics just assist in mastering. So, is way to master cephalosporin. In the first generation, you say that all CEPHA except cephradine and cephaclone are second generation. So cephadroxyl, cephalexin, cephasolin, and cephradine are first generation. So this is just part of memorizing. This is part of trying to classify them. Then when you know the mechanism of action of like first generation, you are in a position to know the exact drug and exact mechanism of action, and later on the dose and the contraindication. So that's it. In summary, we are saying that in the first generation we have the Vaseline, were acting as an example, and we've seen the examples of first generation. But in first generation, we say they have very good active diagnosed gram-positive, and this gram-positive includes staph and streps, which in the second generation, we say that there is increased active diagnosed gram-negative as you move away from first generation to the fifth generation. So it means fifth generation is more stronger to against the gram-negative, but it is less against the gram-positive. Well, when you are moving away from fifth generation towards first generation, it means the activity of gram-positive is increased while that of gram-negative is decreased. So very good gram-negative coverage reasonably at the gram against gram-positive. So that is just an illustration there. We go to the second category of drugs, which is the protein synthesis inhibitors, and they include the aminoglycosides, tetracyclines, macrolides, chloramphenicol, and clindamycins. So, and in the aminoglycosides, we also have another range of drugs in which you could give the mnemonics as tanks, which is the tropramycin, amikacin, neomycin, gentamicin, and streptomycin. So, having known that when you are given like a drug like amikacin, you just know from the word, from the appearance. I mean, when you look at it for the first time, you just know that this one is a protein synthesis inhibitor, and from there you can reason out and you know that the mechanism of action could be simpler, and at least you know how to, the drug first by name. On the other side, we have the amino. It means that aminoglycoside is composed in two sides, which is amino side and the glycoside side. So amino is against the aerobic gram-negative and mainly the bactericidal. Its side effects of aminoglycosides include the neurotoxicity, allergic reactions, nephrotoxicity, and ototoxicity. So these are just to mention. Now we go to the second, which is which is the cell membrane inhibition, and this included the polymyxin. Inhibition of the nucleic acids, quinolones, rifampin, folic acid synthesis, which is the sulfonamides and trimethoprim. So in conclusion, we have seen a brief classification and a broader classification of all the drugs which are named as antibiotics and antimicrobials. So we need to remember about the beta-lactams and other cell wall and cell membrane inhibitors and anti-active antibiotics. So we need also to remember the tetracycline, macrolides, clindamycin, chloramphenicol, streptomycin, and oxidones, aminoglycosides, spectinomycin, sulfonamide, trimethoprim, and quinolones. So as I began, I said that it is important, first of all, to classify these drugs. Once you've classified them, it will be simpler to walk ahead and forge and study about their mechanism of action, and you will be in a position to handle them, and it will be simpler because you are covering in a broader approach. So I would like to take this time to thank you for watching our first video on the antimicrobials, and we ask you to subscribe for more detailed and summarized work in the pharmacology. So welcome and thank you. Subscribe, share, and like.